All right, guys, welcome to the neck and shoulder video. All right, if you're dealing with pain for long periods of time, acute pain, numbness, tingling, restriction issues, you probably need to go to the doctor and get an MRI or see a qualified health practitioner to take things further, right? You know this. Go do it, all right? Because like the stuff I'm showing you right now could make it worse, right? But the goal with this is to show you some bang for your buck, quality, soft tissue mobilization, some mobility and stretch sequences that we've seen help a lot of people with shoulder and neck pain, all right? Now, we just came, we're going up the chain, right? So if somebody has shoulder or neck pain, what's most likely restricted, right? I want you to start thinking like that. So we got to look at shoulder mobility, scapular and thoracic mobility, soft tissue on the upper back, soft tissue on the anterior portion of the shoulder and the arms, right? We're surrounding the dragon. Where is the pain? Find out what is above and below, and most likely you're going to have to get soft tissue work, improve the quality of the tissue surrounding it, and you're also going to have to improve the flexibility and most likely get stronger in your deficits as well. But for the purposes of today, let's go ahead and start right here on our back, T-spine, thoracic mopes. All right, so we're up here, right below the shoulder blades. Hug yourself, and we're going to roll out that upper back. Shoulder blades are away from each other. Protracted shoulders, and we're really just working that upper back tissue. Okay, from here, I'm going to go and roll over to my lats. So I'm right at the border of my rib cage and my armpit right here. Okay, palm up. Okay, and I can play in here, roll back and forth. I can go palm down. Remember, we're going fishing. We're looking for tightness. Look for some restrictions. You're going to find some in here. Guarantee it. Like I said, most people who have low back or shoulder pain are going to find a lot of restrictions in this area of the armpit, shoulders, rotator cuff area. So don't be afraid to get in here. It's not going to be nice, but change angles, play with hand positioning. If you find something really, really painful, they might need to hang out or take a little less pressure off so you're not in so much pain, and just kind of melt into some tissue. Just kind of hang out in here. But you're looking around, going fishing. Now I'm going to get the front part of my shoulder. Okay, so I'm already here. So you might need to play with your leg positioning a little bit, but you're going to roll around on the front part of the shoulder. Remember, if the neck's bothering you, your shoulder's bothering you, you have to surround it. Get the front part of the area and the back part of the area. Palm up again. I'm just playing around now, looking around. So you want to get both sides, right? Even not just the affected arm or the side where the pain is. So get both sides. But here I am, really getting the chest and the deltoid. These areas that become rounded as we sit at the desk all day, or we're stuck in these flexed positions that we live in for so often. We get good at them and we get stuck here. So we have to open up everything on the front and strengthen everything on the back. Okay, so now let's go ahead and go to, since we're done with our soft tissue work, let's go to the ground. All right, so if you have shoulder pain, we have this muscle called the serratus anterior, and we can activate this muscle by protracting and retracting our shoulder blades. So I'm going to go ahead and start getting this muscle stronger. So I'm going to push away and then allow my shoulder blades to come together. Push away, together. And once again, there's hundreds of things I could give you guys to help you. So I'm just going to choose the most bang for the buck couple of things that I can give you. You can start today. If I give you too much, you're not going to do anything. So I'm keeping my elbows locked out. Notice how my elbows don't bend. And I'm allowing my shoulder blades to come together and then push away. Now in here, we can even play a little bit more and get a little bit more advanced with some circles or shoulder cams. You can reverse these. Ultimately, what we're trying to do is strengthen the musculature around the shoulder, surrounding the shoulder. Okay? So I'm playing in here. Don't be afraid to play a little bit. But protraction, retraction is going to help a tremendous amount. Let's go to another great one that's going to help with hip mobility as well. Sit back, and I'm going to take my arm and thread it through. So now I'm working some thoracic rotation. Call these arm threads. Thread the arm through. Try to get your shoulder on the ground. And I'm going to hang out down there for a few seconds. So once again, if you have low back pain, you lack thoracic mobility. If you have neck and shoulder pain, most likely you're lacking thoracic extension and mobility, rotation as well, which we're going to get to in a second. All right, let's go right now to our spinal waves. And we can do this from the ground or standing. I'm going to show you a side view on this one. Squeeze your shoulder blades together. And then I want to push away and round out your upper back. Tuck your hips underneath you. And come back together. So I'm flexing and extending. Anterior glide, posterior glide. So I'm just mobilizing that upper back. If you can get that back moving better, it'll take pressure off everything that is attached to it, which is the shoulder and the neck. So sometimes you can knock out 2 birds with 1 stone hitting the upper back, okay? It'll help you with a lot of things. Let's go to spinal waves now, okay? So on this one, I'm kind of going to mix in some of that anterior posterior glide, right? And we can do it from the floor, okay? So I'm going to go here and I'm going to tuck and wave. Tuck and wave. My arms are staying fairly straight. I'm tucking the pelvis and then waving the pelvis back. So I'm really kind of waving out that spine. It's a great one for spinal health. We have to start moving that spine more. And the more you get into the spine, you're going to help the upper back and take some pressure off the shoulders and the neck, okay? Next up, lateral glides, okay? On this one, I'm going to act like I have 2 towels in my hands. They're wet, and I want to wring them out. So I'm going to wring out a towel, and I'm going to glide to the left. I'm going to wring out a towel, and I'm going to the right. So if you notice what I'm doing lateral glides of the scapula. Before that, I did anterior posterior glides, right? Remember the anterior posterior glides? I did thoracic rotation. So I'm hitting every possible angle that the scapula has availability for, right? So let's glide. Wring out that towel. Wring it out. Look how I'm rolling that shoulder down, okay? I'm rolling that shoulder down. So I'm really mobilizing that upper back and shoulder region, okay? Next up, let's just move the neck, right? Don't do this while you're driving, but you can do it while you're at a red light or when you're at home or the bank or you're at work. So let's put our shoulder blades in our back pocket, and I'm just going to look left to right. Now let's lateral tilts. Okay, now I'm going to do anterior posterior glides, forward and back. Okay, now I'm going to do lateral glides, King Tut style. It looks funny, but you do have this availability. The range of motion is there, but you just never use it. So we need to use it. So I'm going side to side. Now let's put it in a circle. Forward, side, back, side. And I'm going in a little circle. Doesn't matter how good it looks. You may not have the range of motion that I have. But just move, even if it's short, even if it's just a little bit. You're improving the range of motion of your neck, which is going to help with your pain, okay? Now let's go to soft tissue work. I've already addressed this. We're stuck in flexion all day. We have forward head posture, rolled shoulders, tight abdominals. We sit like this all day long. So all this musculature on the front of our neck, our scalenes and our sternocleidomastoid, the anterior portion of our body, our pecs, our shoulders, we have to address it. We need to open up the front, strengthen the back. So how do we get to the anterior portion of the neck by yourself? Because you can do it, right? It's called a pin and stretch technique. So what you're going to do is grab a little bit of the tissue right here. We're going to close it down, and then I'm going to look away. I'm going to flex it, grab some tissue, and go away. Grab some tissue. So I'm just looking around, grabbing, and let that skin roll underneath your fingers. Flex it, grab, and let it roll underneath your fingers. This is a great way for you to learn how to self-stretch. You need to learn how to maintain your own body. So I'm just looking around. And get down here even closer to your breast line. Pull down, chin down, and look up. And look up. No rules. As long as you're not going into any pain or you're not feeling any numbness or tingling, but there's a great way to surround the dragon. Work the front, work the back, work the shoulders, move as many planes and many ranges of motion as you can. Get moving. That's your problem. All right, let's get rid of that neck and shoulder pain. Get to work. I'll see you soon.